And I do get this question a lot from people, older adults. I'm old. Can I do a vigorous type of workout? Again, we're not talking necessarily about just high intensity interval training, although that does include it. We're also talking about, maybe cycling or, running or jogging to a point. I think even jogging was considered more vigorous, right? So, like you had pointed out, this study included adults that were up to age 79. So they're definitely older adults, 65 and older, right? So older adults did massively benefit from engaging in vigorous intensity physical activity. I would say that essentially, most of people that are older, and let's say they've never really done any kind of vigorous intensity activity, it's not that you have to just start it right away. You can work your way up progressively, right? I mean, that's just something to keep in mind. Like, it's easy to kind of just work your way up to it. Start out with the interval walking and then start in doing a little bit of light jogging in sometimes. Or maybe you're just going to be that person that does these short, 1 minute chair squats or, something you're going to accumulate more of the shorter intervals throughout the day as well. But it is important to point out that as you're getting older, as you mentioned, the muscle mass, engaging the type 2 fibers because they're really going, your cardiorespiratory fitness is decreasing. I mean, all of these things, there's so much, I would say, there's so many reasons why older adults should be trying to engage in some form of vigorous intensity activity and not just following the moderate intensity aspect of the guidelines.
Yeah, absolutely. I mean, I think that for one, obviously, even old or young, if you've never done HIIT, high intensity vigorous exercise, you need to ease yourself into it. You need to kind of, adapt to it before you do it. But there are, hundreds of studies on, let's just keep using the Norwegian 4x4, for example, but
research, including studies by Dr. Benjamin Levine, demonstrates that structured high intensity exercise can reverse cardiac aging in middle-aged sedentary adults.
Adults can do that protocol safely, effectively, several times per week, and they're not burning out. It's not unsustainable. I mean, you hear all these words and it's just like, for the people doing the research, and even in graduate school, I was a part of several of these different studies where we used the Norwegian 4x4 and we were looking at the effect on endothelial function. And we had people who were 65 years old with diabetes coming in, and they were doing a couple of these 4x4 protocols a week, 85% heart rate max. It's like, you can do it. I mean, it's the only exercise that they're doing. It's a couple times per week. And even if it's 85% max heart rate, it's a fairly low absolute intensity because they're not that in shape. So people can do it. And then I think it's important, older adults can do it and they need to do it. Going back to what Ben Levine was talking about. I mean, past a certain age,
e.g. 50 plus, higher intensity exercise is crucial to stimulate sufficient cardiac adaptations and prevent age-related stiffening.
If you don't engage in the vigorous exercise, you're just not going to adapt, especially with regard to the cardiac adaptations, the cardiovascular system. The heart just needs that extra stimulus, and without it, the heart's just going to continue to stiffen, fibrosis as you age. I know we already sort of mentioned that, but so yeah, not only is it feasible, but it's probably necessary for older adults to engage in this high intensity interval training.